This is me, as a baby, with my grandmother. I was looking over at my mom, watching her listen to my dad's heartbeat with a stethoscope. From such a young age, I was always intrigued by everything that she did. Not to mention the stethoscope was pretty shiny. My mom, her name is Rhonda, by the way, and I have always been inseparable. Everyone has told us how much we look alike, and the older I got, the more I can definitely see it. I always felt like if I could be more like her, in every sense of the word, I would be such a good person. If I was even half of the nurse that she was, I would be set. And so I started thinking, what kind of nurse could I be? Of course, when I first told her I wanted to go to nursing school, she was all for it. She brought me along with everything she did. And one of the things she did was teach CPR at the local state fair every year for as long as I can remember. And this year it was different. I didn't sit in the corner and wait until it was time to go. I actually put on a shirt and taught CPR right along with her. And seeing the information sink into those people's faces when they learned basically how to save a life was the turning point for me that I knew I wanted to go to nursing school. I asked her, "Mom, I'm not sure if I should go into nursing because I've seen you come home many times and you just look so tired. Do you ever have fun at work?" And then she pulls out this picture. And of course, I knew that it's not always bad. My mom is the one on the right that's the tallest. And she's 5'10", but she doesn't look like she suffers from any heart dysfunction. My mom was actually born with something called Marfan syndrome. It's a connective tissue disorder in your body that affects everything. And when I was 17, they discovered that her heart aneurysm actually doubled in size from the time they first discovered it, which was when I was first born. They told us that she needed to have surgery within the next few months, or she wouldn't be there for much longer after that. And now to see her take her situation and turn it into something really good and focus on the American Heart Association and bringing awareness and things like that, it's just extra that a nurse does. And I value that in her a lot. She is a bachelor's degree nurse, and she does things in the community as well, not only just her job. It makes her a huge role model for me, not just as my mom, but to fill such large shoes as a nurse. So when I got accepted to nursing school, of course she was my biggest fan. And I made a lot of really good friends there. And some of the things that we did was also take part in community awareness with the American Heart Association. I felt like everything I did was exactly what she did, and that's the way that I wanted to go. So during school, I studied every night. I think my social life was reflective of a blank piece of paper. That's all that I did, and it was the longest but shortest 2 years of my entire life. I made great friends, but if it weren't for these two girls, Jenna in the middle and Kristen on the right, I don't think any of the three of us would have made it to graduation day. We cried, we stressed, we laughed, we had great stories together in clinicals, and without those close friendships, I don't think that we could have gotten through it by ourselves. And finally, it was pinning day. I walked across the same stage that my mother did 20 years after she graduated. And the best part about it is that one of my best friends is a jeweler and made my pin for me, had it engraved on the back, and the person that got to pin me was my mother on the same stage she graduated. It was a very emotional moment, and it was great. It was like a rite of passage for a nurse, especially between my mom and I. I just couldn't believe that I was done with nursing school. I was really excited to start working finally, to be paid for the same things we did in clinical. But I was also scared to death because I knew just how green I was walking on the floor. Through the entire program, my parents were my greatest support, and they were my biggest fans. I don't think I could have made it through the program without them. My whole family was a big group of cheerleaders. My mom, dad, grandparents, uncles, cousins, they were all there, and they all came to support me and watch me be pinned. But my greatest influence as a nursing instructor was Ed. Ed's here in the black with me and my mom, and he was my last semester's clinical instructor. He was a department head of the emergency room, and I learned so much from him in 4 weeks than I did from the entire program combined. He really taught me how to take all the information that I learned as a student to be able to apply it to real-world situations. And the most educational thing I learned from him was that it will never be what the book says it will be when a patient presents. It will never be that black and white. And he really taught me how to be a critical thinker. And honestly, without him and his recommendations and teachings as an instructor, I could have been a lot more clueless than I was. If I could take this picture and send it back to me before nursing school, when I asked my mom the same question, "Do you have fun at work?" I think it would have answered my question. The girls that I work with are fantastic, and men as well. And you can have the hardest day, but knowing that you have the teamwork of your coworkers, you can get through anything as long as you stick together. I made wonderful friends. I made wonderful best friends. And I made great connections with people who are no longer there. But at the end of the day, nursing is and always will be constantly changing. And there's no other profession that comes together and stands up for all of the same beliefs as nursing does.